Is it best to try and avoid a crown? Depends clinically, but yes, if we can get away with it, there are more conservative tooth options available, like an onlay. So a crown is where we're taking the top off and all the way around the outside off the tooth, the picture here, whereas an onlay or an inlay is replacing the part which is missing. So I often try and use onlays instead of crowns, or overlays instead of crowns if I can. A crown takes away a lot more tooth tissue, and if a crown is going to fail, it'll fail a lot more catastrophically than an inlay or an onlay will do. So if an inlay or an onlay fails, then you can still progress to a crown or take a little bit more tooth tissue away to make the onlay a little bit bigger. Whereas if a crown fractures, it tends to fracture a little bit more catastrophically. So therefore, we're more likely to lose part of the tooth or maybe need a root filling. So in answer to so many questions, do I have to avoid a crown? You can't always avoid a crown, and a crown is sometimes absolutely necessary. But if we can, and I think dentists now, especially in the last couple of years, are starting to focus more on less destructive options like the onlay and the overlay to try and avoid taking all that extra tooth tissue away what a crown does. And because the crown covers the whole tooth, if it is going to fail, it will fail more catastrophically. So in answer to many questions, if we can do an onlay or an overlay, we do, because it is less destructive.